Thank you so much. Dear friends, it's time to introduce the next keynote speaker. And happy to have Dr. Perry Hystad here with us today. He'll be talking about assessing long-term exposure to urban nature and its health benefits. Dr. Hystad is an assistant professor in the College of Public Health and Human Sciences and at Oregon State University. He's the director for the Environmental Health Program and leads the Spatial Health Lab. His research focuses on connecting people to places to determine chronic disease risk factors and prevention opportunities. He's developing new methods to assess environmental exposures for large population-based health studies using new technologies and data science approaches. One of his past studies examines residential greenness and birth outcomes in a population birth cohort in Texas. So we hope to hear about that as well. Please help me welcome Dr. Hystad to the podium.
All right, thank you for that introduction. I'm very pleased to be here. I'm very pleased to have my voice back. I didn't have any voice yesterday, so we'll see if it holds for this presentation. I won't be talking about the Texas birth cohort study due to time, but please come talk to me at lunch or afterwards. I'd love to discuss it further. So this is a picture of the world at night. Over half of the world's population now lives in an urban area. Over 80% of the U.S. population lives in an urban area. And 60 million new people are being added to urban areas every year in the world. So we know that living in an urban area shapes our exposures to many things. Air pollution, noise, crowding. One of these exposures that's been getting more attention recently, specifically in my field, is exposure to nature or exposure to green space. So how does living in an urban area shape these exposures? Access to nature, perceptions of nature, and what does this mean for human health? So environmental psychology has looked at this for quite some time. This field tends to look at short-term acute exposures using experimental controlled designs. I come at this from an environmental epidemiologist point of view, where we tend to look at observational studies to determine what is the long-term impact of exposure to nature on chronic disease development. So my sort of overriding question in this area is, to what extent is long-term exposures to natural environments causally related to beneficial health outcomes? And the key here is, how do we assess these long-term exposures to nature, right? Is there the cumulative benefit of being exposed to nature in our day-to-day lives? So when we look at how does nature influence human health, this is a simplistic diagram that shows some of the pathways that might link exposure to nature to human health outcomes. So more nature, more green space, less air pollution, less noise, less heat. More green space, more physical activity. That can be due to parks, street trees. More green space, more psychosocial influences. So you're more connected to people in your neighborhood. You have a stronger sense of community belonging. We know that's important to health. And then the psychological influences. So more green space, stress reduction, attention restoration, and what that means for long-term health outcomes. So this is a very high-level summary of sort of the state of the evidence now, linking green space to specific health effects and the pathways that might link exposure to green space or nature to those health outcomes. At the top, where's the laser here? At the top, there's the increased evidence. At the bottom is decreased evidence. This is very much still up for review. So this was part of an EPA EnviroAtlas meeting that they held, where they brought a bunch of researchers together, where we tried to assess what sort of is the state of evidence for types of green space, types of nature exposure, and specific health outcomes. And it was very surprising to see sort of how far behind the state of science was in terms of what we were wanting to do with incorporating nature into built environment design, specifically for improving health. So when we're thinking about how do we assess what you're exposed to in terms of green space or nature exposure over years, decades, or your lifetime, in epidemiology, we tend to do this with questionnaires. So we can ask you about your interactions with nature, about green space in your house, or we can use spatial models, where a spatial model looks at the amount of green space in your neighborhood, which we can link to your residential address. And this is something you'll see in most of the long-term studies to date, is this use of NDVI, so the Normalized Difference Vegetation Index, as a measure of everything green in your environment or in your neighborhood. So you take someone's, let's go back. You take someone's residential address, say if that was their dot, you do a buffer around where you live, and you extract an average NDVI value, which is basically a measure of everything that's green in that neighborhood. Right, so this doesn't distinguish between types of vegetation, and for NDVI it does have to be green. So this is an example of what NDVI would be measuring. So you see a tree, if a tree is not green, it's not captured in this NDVI metric. So a fairly crude metric, but capturing everything that's green in an area, which we can standardize across different areas and across different studies. So I'm going to run quickly through some of the studies that I've conducted to date to try to look at what is this longer-term impact of green space on a number of different health outcomes. So these are the first study that I did in Vancouver, Canada, and I'll explain a little bit how I got into this field, looking at green space and birth outcomes, then looking at mental health and cognitive function. So this was a unique study in Quebec. Another study looking at mortality, and then a study I'm currently looking on to look at what does nature mean for health in global context? So most of the research has been done in North America and Europe. Can we extrapolate these findings to other parts of the world? Thinking that we can do that, or that there's a direct interpolation, is probably overly simplistic in terms of what we're trying to accomplish. So this is the first study that I conducted looking at, is there an impact of green space on birth outcomes? So this is in Vancouver, Canada. You guys probably have caught on to my accent already, so I moved to Oregon 5 years ago. For some reason, everybody is onto my accent. My wife, who's also from Canada, they have no idea, so I don't know what's going on there. So this was a birth cohort in Vancouver where we were able to look at every birth in Vancouver for a 3-year period using linked administrative data where we could get information on health outcomes, on potential covariates or other factors that could influence adverse birth outcomes, and then use residential address to estimate green space exposure. And I came at this from an air pollution perspective, where one of the first studies was just published in Portland that showed this very large association between the amount of tree canopy cover in a neighborhood and benefits to term birth weight, preterm birth, and small for gestational age. And I thought this was entirely due to you have more trees, you have more vegetation, you have less air pollution. And so what we did in Vancouver is we were able to estimate, this is the NDVI or green space in Vancouver, but we also had all of these really detailed models of air pollution exposures, of noise exposures, and then walkability metrics, population density metrics, access to park metrics. And here's a summary of what we found. So I'll just focus here on term birth weight. So in an unadjusted model, we found for a 0.1 unit increase in NDVI, we found a 40-gram increase in term birth weight. So this is a very large impact when you think of a population level exposure. When we added in all our individual and neighborhood covariates, this was reduced to a 20-gram difference. And then when we added in all of these other environmental exposures, different types of air pollution exposures, noise, walkability, those didn't change the estimate at all. And so this is really when I started really being interested in this field in terms of what is it about green space that could have this big of a benefit after we're adjusting for all of these other things that might be on the pathways linking green space to birth outcomes. So to me, this was really surprising and started me off in this area wondering, well, what else is this related to? This is just showing the dose-response relationship between green space in Vancouver and birth outcomes. And one interesting thing we found here is there was sort of a threshold where you didn't see any benefit until you reached this NDVI level. So you had to have a certain amount of green space before you see a benefit. And this is what sort of the lowest level of green space can be on a street. And this is just a satellite image of where that threshold was in this study. Right? So if you're thinking about best practices of how you have to green a city for health, do you have to get to a certain level before you actually see benefits? This is, again, very preliminary, and this would have to be recreated in other studies and for other health outcomes. So the next study I did, this is looking at mental health. So we were looking at depression and anxiety as well as cognitive function. So depression and anxiety was assessed using a number of different scales. In Canada, we have universal health care, so we can also link to health databases to get doctor-diagnosed depression and anxiety. And then we had computerized tests to look at cognitive function. So there was 4 different tests that tested different domains of cognitive function. And here we saw protective associations for the more green your neighborhood was. We saw a 15% reduction in depression, a 19% reduction in anxiety. And we also looked at what happens if you move. So if you move to a greener neighborhood compared to individuals who also moved but moved to a neighborhood that had the same green space levels, we saw consistently better outcomes in terms of depression and anxiety. There was no associations at all between green space and our cognitive function measures. So we saw something for depression and anxiety, nothing for cognitive function. Just looking at my time here. Okay, so this was an interesting study where, again, in Canada, we can link between our medical records, and in this case, we linked it to our long-form census information, which provides us a lot of detailed information on socioeconomic status, behaviors, and then we also link this to tax records. So from tax records, we can get your household income as well as your lifetime residential histories, or at least going back 20 years. So from these lifetime residential histories, we linked to neighborhood green space measures, NDVI and proximity to water, to see if there was this association, in this case, with cause-specific mortality. This is a summary. This is for non-accidental mortality. So for approximate 10% increase, again, in this neighborhood green space level, we saw reductions of 7 to 9% for non-accidental mortality. This is the dose-response relationship. So at the bottom here, this is increase in green space, and then this is the hazard ratio for non-accidental mortality. This was very surprising to me. I mean, 7 to 9% is on par with what we're seeing for air pollution when we look at fine particulate matter, NO2, traffic-related air pollution in Canada. This was even more surprising. So this was a very crude measure of if you lived within 250 meters of water. So is it green? I mean, is nature green space? Do we see something similar with blue space? And here we saw if you lived within this 250-meter distance from water, so you could walk to water, not necessarily viewing water, we saw a 12 to 17% reduction, again, in mortality. Right away, this was very concerning, is this residual confounding, right? So people who live near water are different than people who live away. And we did a lot of things to try to explain this association away in terms of propensity score matching, looking at stratifications by different income levels, and it was higher for people who had lower socioeconomic status. So residual confounding might be part of this, but it definitely does not explain this whole association based on what we did in this study. Okay, so I mentioned this earlier that most of the research we actually have is from North America or Europe. This was just a map showing the annual fluctuations in green space. We did a study that looked at how urban green space, so this is for every city in the world over 250,000 people, how has green space changed from 2000 to 2014? And these are the results summarized by income level. So blue, let's go back. I keep confusing the laser button. So blue is high income countries, so you see it's fairly stable over that time period. For green space, so this is the change in green space percentage. For red, we see low-income countries over that same time period. Cities have seen a 13% reduction in green space. So if we think about where is this really important, it's where we're not doing studies, right? These are where we can actually change urban environments. This is where we're seeing this growth in density. I mean, a 12% reduction in green space is enormous. And these are using a fixed city footprint. So this isn't even accounting for sort of the sprawl of cities. So this is a city boundary in 2000. What is happening to that city over the next 15 years? So this is a study I'm currently funded to look at air pollution. So this is a global prospective cohort study, around 160,000 people in 27 countries, where we have 760 communities where we're looking at environmental exposures. So for those communities, they're in an urban area, they're a small neighborhood. In a rural area, they're a small village. And this is a preliminary study that I've done to look at what does green space mean within this cohort. And the first thing that you run into is using green space is not the right method for capturing exposure to nature, right? So we have studies in the Middle East where there is no green space, right? What they consider nature is not green. So this initial measure of community NDVI is our perspective, or what is relevant here maybe for nature, but might not work in this overall cohort study. This is just an example. This is Vancouver, Canada NDVI. These are the examples of the neighborhoods of the study. And this is Bangalore. So just looking at sort of the stark difference between what levels of green space are measured in NDVI. And this is much lower than what we see in Vancouver. Let's see how I'm doing. It's primarily population density. It's just so dense that, I mean, there's hardly any park, street trees. And so one thing that's unique about this study is we have NDVI, but we also asked some other questions that we can use to get at exposure to nature or green space. So one of them is, are there trees that give shade to the sidewalks in your neighborhood? There's a Likert scale. And then self-reporting, you can walk to a park in 10 minutes. So these were the three exposures that we looked at with a range of different outcomes. So at baseline in this cohort, they did a medical exam, they did comprehensive questionnaires, and then the median follow-up in the cohort right now is 9.1 years, right? So we can look at mortality and cardiovascular and respiratory events for these people going forward. So this really covers a lot of the pathways that we're looking at when we're thinking about how does nature maybe relate to health, right? Is it reduced air pollution? We have measures of air pollution. We have measures of physical activity. We have measures of neighborhood social capital. And then we have stress measures as well. Moving closer to health outcomes, we have clinical measures, BMI, blood pressure, lung function. And then we have, of course, our endpoints, which in this case are mortality and cardiovascular disease. So I kind of skipped over a lot of the statistical methods in the other studies. Here I just want to point out that we try to control, right, where this is a global cohort study, we need to have a lot of controls to look at what is different between Vancouver and Bangalore, right, if we're pooling all of this together. So we control for center, which is sort of the city, regional level, and then we have a random effect for community, country income category, and then depending on the outcome we're looking at, we have a lot of detailed individual and household characteristics that we can control for. And then, of course, here, looking at interactions by country income status is important. So I'm going to run through some of these really quickly in terms of some of the pathways. So this is just summarizing results for the association between our three measures. So NDVI for a 0.1 increase, trees, right? So there's trees in your neighborhood that give shade to sidewalks, and you can walk to a park in 10 minutes. And this is looking at the association with if people said they're satisfied with how easy or pleasant it is to walk in their neighborhood. Right? So if you have trees, you're 3.5 times more likely to say that you're satisfied with how easy it is to walk in your neighborhood. This looks at satisfied with your neighborhood as a good place to live. And again, we see over a 2 times increase for if there's trees, a 20% increase for the green space, and a 37% increase if you can walk to a park in 10 minutes. So very strong results in terms of just neighborhood satisfaction. Things get a little bit more mixed when we start looking at physical activity. So this is a linear scale of walking METs per week. And then if you meet the physical activity guidelines of over 525 METs per week. And you can see that we're seeing these increases with trees and if you can walk to a park, but we're actually seeing a reverse association with the level of greenness in a community. And again, these are fairly preliminary analyses, and I think this is really related to density. And this is an issue that we have when we're looking at green space, is if you go to suburbs, your level of NDVI gets a lot higher. But is that actually a better environment to live in, right? Is that what we're capturing is quality of green space? So I think that's what's going on here. Again, these are fairly preliminary. Same thing here. But this suggests if you can walk to a park, you're 17% more likely to meet physical activity guidelines. So these are results for BMI, systolic blood pressure, and then lung function, FEV1. Again, we see some of these mixed results, but for green space, we see a reduction. Parks, we see a reduction. Here, no association with trees. For systolic blood pressure, we see a reduction across the board. And then for lung function, we see an increase for green space and parks and no association with trees. So here is the initial analysis looking at cardiovascular events. So this is fatal or non-fatal stroke, MI, or heart failure. We see no associations across the board with these. Non-accidental mortality, we don't see any associations either, except for if you can walk to a park in 10 minutes. This is showing the results for if you can walk to a park in 10 minutes for each center, and you can see really strong differences between high-income and high-middle-income countries and then low-income countries. So this is really getting at what we perceive as beneficial maybe in Europe and Canada doesn't apply directly to what might be beneficial in some of these other settings. So right now, this study is really showing that nature and green space exposure pushes all of these health-related behaviors and some of the clinical markers in the positive direction, right? So they're making people more attached to their community. There's reductions in air pollution exposure. There's slight increases in physical activity, but these aren't enough to move hard endpoints in terms of cardiovascular disease or mortality. And to me, this isn't surprising, right? Looking at the diversity of environments that are in this study and what is determining cardiovascular and non-accidental mortality. So to me, this is still a good news story. This is part of the answer, right? This is sort of Jeffrey Rose's let's push risk factors for whole populations in a positive direction. So everybody is benefiting, but other things have to happen to influence cardiovascular disease and mortality. Okay. Oh, I'm doing pretty good. Okay, so research needs. So that was sort of a quick overview of some of the studies that I've done, what I'm working on. One of the cruxes of these studies is really exposure assessment, right? How do we accurately assess over years and decades what your exposure to nature is? That's very difficult, and we tend to be using this really blunt tool of NDVI. And that's because it's available, it's easy to use, it's standardized, and it's a measure of everything green. So it's sort of a composite measure of green space. So we really need to start getting at use of green space, quality, perceptions of green space in nature. Most of these studies completely ignore indoor exposures. There's very few large epidemiological studies that have good questionnaire data on what are your indoor exposures to nature. And then looking at measures specific to pathways, right? So if you're interested in how urban green space influences cardiovascular disease through physical activity, you might want to use a different exposure measure than if you're interested in how it reduces air pollution, which then impacts cardiovascular disease. Quasi-experimental designs are really needed in this area, and that tree planting study was absolutely amazing. If you want Portland, we're pretty green already, but research outside of high-income countries, and then more studies trying to link short-term and long-term exposures. So we have this really sort of robust environmental psychology literature that's looking at short-term exposures, but how do we link that with some of the long-term exposures that we're interested in looking at? So this is a Healthy Places app that we've developed. This is really something we're looking to embed in existing cohorts where we can ask questions and get measures that are specific to green space exposure. So this could be, right, take a picture of the views from your house, from your living room where you spend most of your time, right? We can quantify what your views of nature are. One of the other things that we can do is look at time activity patterns. So we are only using where you live to quantify what your exposures are to nature. We don't look at where you work, right? We don't look at other recreational locations. And this is a study in Seattle. So we had GPS tracks for 288 identical twin pairs. And we found that, again with the laser, the relationship between, if we use just your home address to say what is your green space exposure, and if we use your detailed GPS tracks for actually where these people went in a 2-week period, the correlation is 0.68. So we see a moderate correlation, but there is a lot of exposure misclassification in terms of just using where someone lives to represent how they interact with nature. One other thing we're doing with this study is looking at, can we use Google Street View images to assess street level nature, right? So pulling out trees, grass, shrubs, flowers, to look at what someone's visible exposure might be. So a lot of our interaction in urban environments are at the street level. And right now we're using this satellite measure to say we're measuring from the bird's eye view, this is what people are exposed to. So using more detailed methods to try to get at what street level exposure is will be important. And then this is something that's sort of always been at the back of my mind when I've been looking at green space exposure. Is it green space or nature, or is it beauty? Right? Is there some other construct that nature is driving, but it's really, it can be something different, right? So if you think of European squares where there's a fountain, sculptures, and no green space, does that have the same benefit as a square with green space? And so this was a study, MIT had this website running where you'd go to this website and they'd present 2 street view pictures and they'd say, which place looks more beautiful? And all you do is you click on which picture you think is more beautiful. There's other questions that say which image looks more safe, which image looks more engaging, attractive. There's 5 different questions that they asked, and they made this data available. So here, I think we ended up having 1.7 million rankings between photos that we can then use using deep learning methods to train algorithms to say, can we predict the beauty of a streetscape based on these trained data? And so that's what the study we're working on now, where for every image we have an attractiveness score, so for 400,000 images in 52 cities, and we want to see how important is green space and nature in an image to the score that's given to that image based on the 1.7 million people clicking on which image is more attractive. And again, we're just starting to get at this. But what we're finding is indeed nature in these images is driving what people say is the most attractive, the safer, the most engaging streetscapes. This is just a correlation looking at how our measures from the street, from remote sensing, so this is the NDVI, and then crowdsourced relate to each other. And we're finding that these street level measures of green space are different from what we're measuring in NDVI. So we're seeing something with NDVI, but the streetscape measures, at least the correlations, are around 0.4, right? So these are a different exposure measure that might be providing more benefit or different benefits to these health outcomes we've looked at. So this is a study one of my postdocs is doing now. He's not giving you the bird. I think he looks like he does. This is actually my postdoc's husband, so he always points that out. And this is where he's wearing a mobile EEG, a non-invasive ambulatory blood pressure monitor, air pollution monitors. And what we're doing is this is trying to link some of these short-term physiological responses to urban environments and urban green space. So this is Corvallis. Corvallis is a small town where Oregon State University is. We have 3 exposure routes, right? One is through a park, one is through a residential area, and this is one of the busier roads near campus. We randomize where people start, what direction they walk in, and then we look at all of these continuous physiological responses. Again, we're seeing stark differences between the park, the residential area, and the busy street. And the goal of this study is, can we quantify these changes for real-world level exposures? So moving some of this out of the laboratory to get closer to, if this happens repeatedly over time, what is the impact on sort of chronic disease within populations? All of this is really focused on unpacking this green box, right? So what is it about green space that benefits health? What are the specific pathways? What are specific exposures? I think microbiome was mentioned earlier. I mean, there's a lot of ways that green space could be influencing health. And if we really want to develop some best practices for how do we incorporate this into city planning, into policy, we need more information on what is it about green space that influences human health. That's it for me. There's Mount Hood from Oregon. Thank you very much.
Thank you so much.